Good morning, everyone, and welcome to our first session for this morning, where we'll be looking at building consensus for the need for change and articulating a shared vision for family hubs. I'm Julia Mays, the Evidence and Implementation Lead here at the National Centre for Family Hubs. At our first conference in November, the Early Intervention Foundation, our evidence partner, and ourselves launched our Family Hub Implementation Toolkit and a Family Hub development process, and shared guidance and resources to support you as you bring partners together and develop a shared vision for family hubs in your local area. Drawing on learning from the research that the EIF have carried out with local areas developing family hubs and integrating family services, this process involves bringing together stakeholders through a series of workshops to build consensus for the need for change, co-produce a theory of change to articulate the local family hub approach and how it will add value to your existing family hub early help system, and develop an implementation plan. Over the course of this year, we have been working with a number of local areas as they start to develop their family hubs and together learning about what might be useful for other areas as they go through this process. We'll be disseminating this learning and additional resources via our implementation toolkit over the coming months. But this morning, we're pleased to have two of our local area partners joining us to share some of the learning from their journeys so far, along with Donna Malloy from the EIF. Donna is Director of Policy and Practice at the Early Intervention Foundation and is going to kick off this morning's session looking at how we use evidence to develop accessible and inclusive family hubs. We're then going to hear from Geeta Hagen, Service Manager for Families Together at London Borough of Redbridge, about the experience of going through this process in Redbridge. And finally, Mohammed Jalil, Head of Early Help and Children and Families Service in London Borough of Tower Hamlets, will share what he's learned as they have developed their shared vision for family hubs in Tower Hamlets. Thank you so much, all of you, for being here this morning, and over to you, Donna.
Thank you, Julia. Thanks so much. And good morning, everyone. As Julia says, I'm going to talk about using evidence to develop accessible and inclusive family hubs, something I think that was illustrated so powerfully by the video just now. And I want to say a little bit about how the Family Hubs development process can help with that. That's a process that's been developed by the Early Intervention Foundation in partnership with colleagues from the Anna Freud Centre. So I want to just say a little bit about that. But just to start off, if we can move to the first slide, I wanted to start with a few key principles, which will be really familiar to everyone listening here, but it is worth reminding ourselves. Firstly, we know that wide and persistent gaps in children's development open up early. Some children struggle to thrive from an early age, and we have a good understanding now of the risk and protective factors which can affect children's development from pregnancy onwards. We know that intervening in the right way at an early stage can help families cope, can strengthen family relationships, and help children avoid negative consequences later in life. And we also know that when we use evidence, this can help us design and deliver services and strengthen the quality of support available for families in ways which can improve outcomes for children. We also know, as you all know only too well, that too many children are struggling to thrive currently and end up needing specialist support. This has obviously been exacerbated by the pandemic and now by the cost of living crisis, as Andrea referred to. We know that local support services are often not well joined up from a family's perspective. They can be difficult to navigate and often not available until things start to go seriously wrong. And we also know that those leading services locally can often find it difficult to collect and use evidence which they can use to build an effective support offer for families. Next slide, please. So these challenges are complex, but family hubs can offer some solutions by focusing on, firstly, access, of providing clear and simple ways for families to access help and support, connection, bringing together different services, developing common approaches across agencies so that families get more effective support at the earliest opportunity, and relationships, supporting family relationships and building on family strengths. And so we would argue that if family hubs are to succeed, they need to be intentionally designed with co-production, access and inclusion at their heart. As you all know, success depends on reaching families and responding to their needs in a tailored and timely way, and hiding some of that organisational machinery, which can be a barrier too often for families. Different local partners and organisations have to collaborate and work together closely to agree a shared vision for their family support system. So, as you might expect, we would emphasise that family hubs need to use good evidence if they are to have the best chance of reaching and supporting families that need it. If we could move to the next slide, please. Evidence is important in developing effective services in a number of ways. And again, I'm sure many of you know that. We would really stress the kind of contribution of different types of evidence to the process of working out a family hub's offer locally. So firstly, obviously, academic research on child development can be very important in helping us to identify the risk and protective factors which affect children and can help us target local services effectively. Evaluations of interventions and services. Obviously at EIF, we spend a lot of time looking at what works and evidence about impact. This type of evidence is really important in telling us which types of services and approaches have been shown to improve outcomes, and so help us to judge whether the support that we might be considering delivering locally or are delivering locally is likely to work and have an impact. But also there are lots of other types of evidence about the local system, which can be really crucial as part of the process of planning and developing family hubs. So data on what the population looks like, what it needs and how that might be changing over time. Data on service user and family experiences of local support and priorities, as we heard about just so powerfully just then from the video. Organisational data on how interventions and services are delivered, who they're reaching, who's been missed, and what do we know about the skills of the current workforce. And lastly, practitioner knowledge and intelligence and their perspectives on how well interventions and services might be working and why. And the point of all of this really is just to emphasise that this combination of research and local evidence can be hugely powerful for the planning and delivery of accessible and inclusive family hubs. Just as one example, we know from recent work, which we've called our Speak Out project, looking at the experiences of minority ethnic families and children when trying to access family support services. Those families told us they often didn't feel heard and understood. Some families involved in that research described feeling judged when trying to access help for their child or family. Yet we know that the quality of the relationship between a practitioner and a family, child or young person is absolutely key to the success of any intervention. So this type of understanding about how families are experiencing services now can be vital. And there's more information about that specific piece of work as part of one of the breakouts later. But I suppose the other point to make here is that we know developing and assembling this type of local data isn't easy. All of our work has consistently shown how challenging it can be for those working locally to generate and use good evidence about population needs, workforce skills, or the impact and outcomes being achieved by their current local service offer. And so next slide, please. And so the Early Intervention Foundation and the National Centre for Family Hubs have been working to build what we're describing as the Family Hubs development process to take account of these specific challenges. The process considers all of these different types of evidence and emphasises collaboration and building consensus across partners locally about the forward direction of travel. It has three main steps. The first, as is on the slide here, is about building consensus about the need for change, which involves gathering as much evidence as is available about the current situation for families and bringing stakeholders together to agree that change is necessary. Step two focuses on working out what the specific added value is that a family hub approach can offer and how we can make sure we're adding as much value as possible to the current service offer. And step three then is the practical planning of how to implement the changes that have been decided on by partners, including putting in place arrangements for evaluating and monitoring what the impact of new arrangements have been and whether that's made a difference to families. And this work involves building a theory of change for the local area around a common vision shared by partners for family hubs delivery. And so final slide, please, from me. So just to finish, what have we learned from using this Family Hubs development process and our work on system planning? Well, I think a few things worth highlighting here. Firstly, there are no quick fixes. This work takes time. Focusing on building relationships with partners locally is more important than treating this as a series of practical tasks or transactions, and building those relationships, as you all know, takes time. We've learned that local areas are often in very different places when it comes to using evidence as part of the process for developing services and developing family hubs. And pulling this sort of data together can be felt to be really, really challenging, although important at the same time. The process helps to bring people together. And in some of the areas where we've tried this, has made the data that's available much more visible to partner organisations than it was previously. People are really valuing the opportunity to stand back, look at what the data is telling us about the whole system and how things have shifted over the course of the pandemic, and what that might mean for how partners collectively want to move forward. Another point is that where there isn't an existing early help strategy in place, working through the Family Hubs development process has been harder and more challenging, as agencies often don't have that recent experience of working together in this way. But even in those cases, we found that the process has really galvanised relationships and created new motivation around working together. We've learned that external facilitation can be really helpful in terms of supporting that relationship building. And finally, that local areas have appreciated the structure that this guidance and the tools we've developed has provided, as well as the opportunity to learn from others who are going through the same process. So just to finish, we are very much on a journey here, I think. I can't offer a final position on how we should be using evidence to develop accessible and inclusive family hubs. This is very much work in progress. But to bring it to life now, I'd like to hand over to Geeta and Mohammed, who are two colleagues from two of the areas that have been working through this process and can share their experiences.
Thank you, Donna. So my name's Geeta Hagen. I'm from the London Borough of Redbridge, and my role in Redbridge is as a service manager of an early help service. Just to give you a little bit of information, there's quite a lot of people here that might not know Redbridge. Redbridge is a London borough. It's a very diverse borough, a borough that right now our system has very, very strong partnerships. We've got very good services according to Ofsted, and we have a strong service offer. However, when analysing our system, the system works very separately still. So we have a separate early years service. My service, which is children's social care, early help service, is separate. So it was a really good time for us to start this process and really think about how we can improve the journey for some of our service users and how we can improve these services further. Redbridge started their journey to develop family hubs following some successful funding from the COVID recovery grant. The grant funding was a small pot of funding to do two things. It was to build consensus. Do we need and want family hubs? And secondly, if we do, sort of what does that offer look like for Redbridge? Unfortunately for Redbridge, we were not eligible to apply as part of the 75 local authorities for further funding from the Department for Education, and we didn't get extra funding through the transformation bids. However, what's really important, there was a very clear mandate following the work we did, and there's a clear intention we're going to stay on this journey and we're still going to make it happen. So for many of you that are now part of the new local authority starting their journey, you'll be a bit like me, which is this is a great opportunity, but you're also managing lots of other work. You're doing this alongside your day job, but you still want to do a great, you want to do a good piece of work. So right from the beginning, I was very clear that this offer an opportunity to work with the National Centre for Family Hubs and the Early Intervention Foundation, and also our regional lead, the Westminster Council. We were very keen to work very closely in co-production with them, as well as our local partners and residents, was very important. But what I'm going to talk about today is really the partnership we had with them, who you've Donna and Julia have already described the offer of support, and I'll be talking about how I've applied it, because it was really important for a local authority like Redbridge. We have got outstanding services. So building that case for change, we really had to use the evidence, we had to use the resources toolkit to really make a strong case for change. What else does moving to this framework, moving towards family hubs help us? So right from the beginning, one of the first things I did was visit Westminster Family Hub, and we did a lot of work with Westminster to understand their journey, and they talked us through that, and I think that's really important. The second most important thing for me was building a network of local authorities. Mohammed, who you'll be talking to, we worked closely with him, and the first two stages of our family hub development, we were keen to test the toolkit at the National Centre, and worked very closely with them to, first of all, prepare for our first workshop, which had 80 plus delegates in person coming together to look and build change, look at the consensus, build consensus for this change. We were provided, and I'll talk a bit about what really helped. There were a number of things that really helped us in Redbridge. The planning sessions. I was always very open that although I've delivered lots of services, we have followed, often they're done quite quickly, and we don't have this support as we were being offered. One of the other things that really worked well for me was to observe consensus building workshop in Tower Hamlets. Go there and see it, see what's happening and learn from that visit. The modules from the toolkit have been particularly useful, and also a little bit of the homework that I've done with Julia and Karen from the Early Intervention Foundation and colleagues is, we've got this workshop, how do I gather data? So they were very supportive in giving us templates on what sort of data we should be looking at locally, and helped us present that data to our partners locally, and also sort of supported me in not being scared to spend this time looking at our data locally, looking at the need, especially after COVID, but also looking at the system as it stands now. And one of the things I particularly found valuable was what Donna mentioned, the external facilitation. It helps be a bit more neutral when, for example, I'm leading it and I am from early help. It was very important that it didn't feel like a children's social care push. We wanted it to be really everybody, so our partners from health visiting, public health and children's centres all feeling they are able to look at what's happening. So just to finish, the other, what I'd like to say, one of the things I found really useful and I think was really powerful in our events. I went to events like where we are today, attending them and really thinking about how that vision is shared and also how we analyse our system. I used a very powerful speaker to come to Redbridge, Eliza Fricker. She is a parent of a child with additional needs and also a cartoonist. She was able to, at our event, really show the partners there about her experience, how she sees the system. So very much before we all went in to describe what the system looks like, we had to sit there and really listen to her, and it was really powerful. So yeah, that's really for us. We're still going through the process now for our second stage, which is the theory of change work, which once again the Early Intervention Foundation are supporting us with. Thank you. Over to you, Mohammed.
Thank you, Geeta. So London Borough Tower Hamlets, really, if we can go on to the next slide, please. So for some of you who may not be aware of it, we're adjacent to the City of London, and we're sandwiched between, I suppose, the City of London and Canary Wharf. And we've got, it's almost a tale of two cities, really. We've got people that are one of the most highest earners that work in our borough, but also we've got, in terms of poverty, we're ranked fourth in terms of IDACI, and some of our wards are some of the most deprived in the country. So that's the kind of place that I work in. I'm responsible for early help, and we've really been on a journey in Tower Hamlets. In 2017, we had a really difficult Ofsted inspection, which told us that we were really failing our children and families here. And the words used was that we had a very fragmented service. So we as a local authority decided at that time that we were going to try and bring all of early help together, and we were going to do it over a number of phases. So phase one was about creating an early help service, and at that time it was created in education. And later on in 2020, the early help service moved to a new division called Supporting Families, which included social care. In 2021, we had quite a significant merger of what was the integrated early years service and the children centres at that time, and they became a part of early help. And it meant that all of a sudden we had a huge number of children's centres, which became our children and family centres. And at that moment, slowly we started to get the kind of guidance being published and us adopting the guidance around what was to come in terms of family centres. So phase three really has been, and I think it's been rather chance more than kind of deliberate, that we find ourselves moving to something that's very much more aligned to the thinking that we already have in terms of what family hubs were. So if I can move on to the next slide, please. So we were lucky at that moment because of the work that we're doing and where we work in phase three to be in touch with the EIF and Anna Foundation, Anna Freud, Centre, and they were about to launch their work around the theory of change, which Donna has gone through, and we started the discussions in January this year on what that might look and how that might change. We're one of the local authorities that has got a strategy for early help, but it was due for a refresh anyway. So it kind of the glove kind of fitted really well, that what we were going to do was update our early help strategy, but then also take into account what national and what locally we wanted to do as a local authority in taking the family hub work forward. If you can move over to the next slide, please. So what has been some of the challenges for us. So initially, when a lot of our elected members and some of our partners, when the discussion about Family Hub took place, it was just, oh, it's going to be quite simple. We just extend what the children's centres do, and 0 to 19, we'll just see what we can do. And just to change that mindset and concept, that actually, no, it's a significant change from what children's centres used to be to the family hubs. And what it means was something that we had to work quite closely with our elected members, with us as well, because in London Borough Hamlets, our children's centres are very, very much cherished by the community, and you start to meddle with them, and the community get very, very upset, and they'll be banging on the elected members' doors quite quickly. So it was important that we worked with our elected members to make sure that they came along on that journey with us. Donna mentioned about the journey. When we started the journey, we thought that when we looked at the theory of change, we thought we knew where we were. And then we had our first kind of meeting with our partners, our stakeholders, and parents and families. And quite quickly, what they told us was that the partnership that you think you've got, yes, there is a partnership, but actually the partnership is you, the local authority, are the big boss, and you tell us what to do, because there's usually money attached to it. And then we're all scrapping about trying to put in applications or go through processes to access that money. So we needed a mind shift, and we needed a change in that, and we took that on. So straight away, what we realized that the initial session where we thought that we were going to get consensus for change, we didn't really have it. And what the participants told us was that we in Tower Hamlets work in 4 different localities, that actually we needed to take this back to the localities, and the localities wanted to understand it better, wanted to be more involved in it, but wanted to feed into it. They really wanted the co-production to mean co-production, rather than we came, presented some data, and then everyone agreed. So so one of the things that we learned that quite quickly was that we thought where we were, we knew where we were, but actually once we listened to our partners and our stakeholders, we needed to kind of think about, okay, slowing the process down. And we did slow it down, because when we started the first session in March, we thought by now we would almost be at the phase where we would be starting to think about actually running a pilot. And we're still almost at stage 2 in terms of the model that Donna showed. Just be cautious when we use our data. One of the things that we did find was that some organisations, some services had data readily available, and also were able to articulate the data. So when it came to the theory of change and looking at putting together a case for change, that those organizations didn't kind of, or that data didn't overshadow data where data wasn't readily available. So we knew, so for example, health data for us, we were really rich in, and what we became quite conscious early is that they also had a very strong voice in our localities, etc., etc. So what we were finding was that a lot of the priorities that were being expressed the loudest were health priorities. And some of the voluntary sector organisations, some of the other partner organisations, young children organisations, etc., weren't really getting the mileage that they should be. Common language. Always a challenge. What something means to someone, and what does, we spent a long time trying to articulate a set of common language, a set of values that we all agreed on that we could take forward. true co-production with partners and stakeholders takes a lot of time, energy, and patience. And one of the best things that I think that we did was quite early. We realised, and as Geeta mentioned a little bit earlier, that trying to do this on top of your own job and trying to coordinate it is a really big challenge. So we took on a project manager, and we passed, and that project manager really helped us in trying to start to think about and just start to organize things so that we didn't we kept with a flow, but also making sure that we were developing as we wanted to develop. So just some of the challenges. Next slide, please. So just looking at some of our successes, we've got an early help strategy in its first draft, and for the first time, it really does feel in Tower Hamlets that it's owned by our partners, and it was done. It's taken a long time to do it. We thought that we would have it done in last April. It was supposed to be published in last April, and we've just got the first draft done now. But in terms of the vision, in terms of the shared behaviours, etc., it was really developed through our partnership model in the localities and then brought together. The shared vision, I just can't how important it is, and to make sure that it doesn't feel that it's a shared vision that's done to your partners, and it's come up with your partners, and the shared values as a result of that have really kind of made us stronger as a partnership, but also it started to help us identify a framework that we want to work. So we had a number of different organizations that had different frameworks that they worked in. Some did trauma, some did relationship based, 5 for Thrive, etc. So when we started to have that discussion about common language, we decided that because some organization had really invested in their services, we didn't want to scrap all the work and come up with an overarching, it just wouldn't be possible. So what we then decided to do was think about common behaviours that we wanted in early help, and started to define what that meant. And what that meant was that it doesn't matter what framework you had in your organisation and what you worked with, we all shared a common behaviour. It's really made us as Tower Hamlets become a much more outward looking authority, where previously when families and we've seen that when families really wanted early help, you always turn to the local authority. Or you wanted support, you kind of looked at what the local authorities do. The partnerships in the localities, we've already started to see is that when people when families now want support, there's slowly a culture where you go to this network, this partnership, and it doesn't matter who you go to. The idea is that what you will do is you'll slowly start to they will make sure that you're getting the right support, and linking you in with the right support. Finally, what I'd just like to say, sorry, next slide, please. So this is just a quick idea. We thought that, as I said, that we would really be at a stage where we would be starting to develop our model, and we would have a pilot. And given the interaction, given the meetings, and the feedback that we've had, we really had to slow that down, and make sure that we went at a pace where we had people that were able to keep on the journey with us and didn't feel that it was just a tick box exercise. And again, I'd just like to finally say that it's really hard stuff, and it takes time. And in Tower Hamlets, I know that we haven't always got it right, but it does feel that the work that we've done and the collaboration that we've done with our partners and families, families told us that, at the first session that we don't want any professionals at a session. We just want families to come together so that we can tell you what we want without the influence of other people. So we went away and we organised a whole conference where it was just families. We got volunteer families to come and run the sessions, run the kind of workshops, etc., so that they could then feed back to us what they their voice and what they wanted to see from family centres. So it is really hard work, but what I'm saying is that if you really roll your sleeves up and really engage with the community, the outcomes we found in Tower Hamlets have been really, really useful, and it feels for the first time here, certainly, that the families are our partners are on that journey with us in terms of developing family hubs. Thank you.